All right, welcome back. Here is the interior of the heart. Cutaway, I think this is exactly the same as on your sheet. On the right side of the screen is an actual human heart that's been opened to show some of the things that are on the cartoon version. So, well, let's get going. So once again, this is the aorta right here. This is the superior vena cava and the inferior vena cava. And the blood enters from those vessels into the right atrium. Okay, so if you're entering the heart on the right side of the body, it's through the right atrium, and that blood is then going to go from there into the right ventricle. So once again, you remember the right atrium is much bigger than the left atrium. You can see the same thing with the right ventricle versus the left ventricle. Anyway, so this is your right ventricle, and it bypasses this valve right here. This is the right atrioventricular valve, also known as the right AV valve, also known as the tricuspid valve, because it has three cusps or flaps. These flaps, you notice, have cord-like tendons called chordae tendineae, and they attach to these finger-like projections of the muscle wall of the myocardium called the papillary muscles. Okay, so when the papillary muscles contract, they tighten up on these cords, the chordae tendineae, and it causes the flaps to close. Okay, or it keeps them from opening up back into the right atrium. So at the base of the pulmonary trunk, this is the pulmonary semilunar valve because it has two moon-like flaps. Okay, so the blood is going to be, when the ventricle contracts, is going to be expelled into the pulmonary trunk, going on to the lungs to be oxygenated. All right, blood coming back from the lungs becomes oxygenated. It's a bright red color, and once again, coming by way of the pulmonary arteries. The pulmonary veins, and empty into the left atrium. Okay. The left AV valve is also known as a mitral valve, or it has actually two cusps. And for some reason, it's called the mitral valve because the two of them together kind of form like the pointy hat that the bishop wears. You may have seen that, which is called a mitre. So it's called the mitral valve. So once again, papillary muscles, chordae tendineae. When the ventricles contract, the blood that's in the left ventricle gets pushed through the aortic semilunar valve. So that's right at the base of the aorta, and then out through the ascending aorta arch, and then into the branching blood vessels. Okay. Right in between here, this is called the interventricular septum. Okay, so it's all myocardium, all muscle. You'll notice once again the right side. Look at the thickness of the wall of the right ventricle versus left ventricle. And if you think about it, once again, it makes sense that this is thinner wall, because where is this pushing to? It's pushing to only to the lungs, right? It's pushing blood only to the lungs. The left side of the heart has to push the blood to all parts of the body, all the way out to your little pinky toe, and have enough pressure to get back again. So much thicker walls, stronger force of contraction. These are all things that we'll get to learn later on when we get into the physiology of the heart, which is quite fun. So I mentioned before the ligamentum arteriosum. During fetal development, excuse me, there is a tunnel that connects the atria or the aorta with the pulmonary trunk, because during fetal development, your lungs aren't being used, so the blood is bypassing the lungs and it's going through here. There's also another opening back here in the atrium called the foramen ovale, and that was another bypass shunt for fetal development, and that closes up when you are born. So, running out of time again, I like to blab, I guess. You can see the corresponding structures here on the real heart, and well, take care, everybody. We'll see you again soon. Bye for now.